A very good morning to one and all present here. This is the first session of the day. Before starting this session, I would like to invite Dr. Kavita Arora to kindly come on the dais and give us gist of the session, of the entire session. Dr. Kavita Arora, please.
Good morning, everyone. I sprung this at the last minute on Anjali, that instead of starting with Dr. Amit Sen, I'd like to come up and give a 2-minute context to the entire session. Therefore, she has, suddenly, without introduction, needed to get me here. So, I'm a child psychiatrist. I've been working in the NCR for the last about 22 years now. And one of the pieces of work that I've been doing is to work with gender diversity. Today's session for mental health, we've tried to conceptualize in a way that helps to understand how we think the foundations of healthcare need to be built, because that's the theme of the conference. And who are the stakeholders and who are the contributors? All over the world, traditionally, when we speak at conferences, it has been healthcare providers, people who make policies, managers, or people in government who talk more and who are called upon the stage as experts. However, the trend and the need today is very different, and spokespeople from the community are extremely important as stakeholders. So this section is trying to draw from the various kinds of stakeholders to ask them to share their views on what they think their dilemmas have been, what their struggles have been, what their ideas are. So talks today in the morning are going to be one from Dr. Sen, who has been practicing for the last 25 years plus, and has possibly seen the changes that have occurred in the social discourse of how gender diversity is being seen. So as a mental health practitioner, but also as someone who is a co-founder of a mental health service for children and youth, this is going to be a very valuable set of insights. Then we have a conversation with Tia. Tia is from the community, sitting right there, and has consented to provide and share her views on her journey of navigating mental health care as well as healthcare services in the last several years. And then I will try and attempt to summarize with some interaction from all of you and audience about what we think the scope could be, and maybe reflect together rather than dictate, reflect together on what the possibilities are of how and what a mental health practitioner or a mental health care service in today's current context of India can be. So we hope that you'll stay with us through this journey, through these reflections. And I'm now going to hand over back to Anjali ji to do the honors and introduce Dr. Sen. Thank you, everyone.
Thank you so much, Kavita ma'am, for giving us the gist of this particular session. And I think now we will be more clear what the session will be all about. Thank you so much, ma'am. So our first speaker of today's session is Dr. Amit Sen. Sir has done his MBBS from AFMC Pune, MD in Psychiatry from NIMHANS Bangalore, and MRC in Psychiatry from CCST. Sir will be taking a session on thoughts and experiences of a psychiatrist on providing mental health services. So we would like to hear from you, sir. Welcome to the dais. Can we have a huge round of applause for sir?
Thank you. Good morning everyone. Can you hear me? Yes? Super. So as Dr. Kavita was saying, that some of us who have been working in this space, not exclusively perhaps, but in conjunction with some of the other things that we do as bread and butter, we have fortunately come across perhaps in the beginning just chanced upon, and then finally been able to be involved with this space over the last few years and seen how the changes have occurred, the dynamics of it. And again, I consider myself privileged to be able to see it from so close through the lives of many young people that we have partnered. So I'll take you through quickly the story of Malti. This was around 30 years ago, and I was working as what is called a senior resident in one of the government hospitals in the Department of Psychiatry. And so Malti was 25, and she had the courage to walk into a psychiatric OPD of a government hospital. Some of you who have been to government hospitals would know how that feels like, right? So she was assigned the gender of a male when she was born, but through her teenage years realized that that was not what she preferred to be. In fact, she had this innate drive to express herself as a woman, and when she started coming to us, she was, you know, in her manners, in the way she dressed, in the way she expressed herself, a very sensitive and gentle woman who was determined to carve her own path, right? We were naive to this. This was, as a bunch of senior residents, we hardly knew much about how to help her. So we, you know, went to the library, dug out whatever articles there were, tried to understand what this is all about, looked at the criteria for then gender identity disorder, and took her through some counseling and introduced her to a fellow professional, a young surgeon who was a part of the faculty. And he was also very enthusiastic. He did his own reading and said, yes, we'll do this. So we took her for, you know, took her through a year's counseling, and I think hormone replacement therapy as well. And then the day came when the surgery was ready to have her for sex or gender reassignment surgery. But on that very day, a senior faculty member in the Department of Surgery put his foot down and said, this cannot happen in a hospital. This is against our tradition. There is nothing like this, right? And you can imagine how devastated Malti would have been. And we were too, you know, and she left with a deep sense of being let down. And I carried this burden for the next many years. So 12 years later, while we were busy developing the child and adolescent mental health service in a multidisciplinary or multi-speciality hospital, the one that Dr. Kavita Arora was mentioning, we were doing it together. That was a time when NAS Foundation, which has pioneered the movement with people, you know, having HIV/AIDS or people in this LGBTQ space, and they've done it since '94, and they came up with a proposal which was very compelling. And during this time, we were already beginning to see some young people who would approach us with, you know, dysphoria, gender dysphoria, and they were beginning to ask if we were able to provide them services, and therefore we took it up. It seemed a very compelling proposition. The hospital we were associated with were open to provide us the space. We built a multidisciplinary team. At that stage, the psychiatrist was a gatekeeper. So oftentimes a young person would come to the surgeon and say that, you know, I need surgery, and because I've already, you know, understood where I stand in terms of gender and my identity, and I'd like you to help me with it. And the surgeon would promptly then send the person to us saying that go and get a certificate so that I can do the surgery, right? So we were gatekeepers, and we followed a very medical model, and the whole idea was to actually come to a diagnosis of a gender identity disorder, mind you, that was a disorder perceived as a disorder then, right? And it was, as the people who came to us also called it, non-negotiable. And I think we misinterpreted that, thinking that you either have it or you don't. There's nothing in between, right? And that's the idea or the belief that we started our practices with. Alongside, of course, making the diagnosis of GID, we were also given to rule out any mental health issues, mental illnesses which might influence the judgment of this person who came to us with such a request. So that was the other part of the role of the psychiatrist at that time. However, through our journey, we met many young people, mostly young, who made us question this belief system, who helped us to see the journey, the life of people who go through this predicament and the changes they have to go through, the kind of treatment or responses they have to endure through their time through their family, through education institutions, in the larger society, amongst friends and all of that. So I'm going to highlight one such young person who came to us when she was, this was 15 years ago, right? So let's call her Nalini. Nalini was 19 when she came, and she was born in a rich business family in central India and was assigned the male gender in the beginning. But very quickly in her early years gravitated towards playing with girls and the kind of games they play. As she turned into a teenager, she started getting attracted towards boys and identified herself as gay. And over the next year or two, she confided in her older sister, who promptly told the parents. And her parents took her for what was called, hopefully it was, and not is anymore, conversion therapy. So through the expertise of a psychiatrist and a psychologist, she was given medication and given mini shocks to change her mind. And so she kept quiet. She put her head down for the rest of the few years she had in school. And because she was bright, she could get herself into a medical college in Delhi. So that was her escape. So she came away at the tender age of 18, and she figured at that time that she was not gay, but she actually had gender dysphoria, right? And she grew her hair and started dressing like a woman. But the faculty in that medical college was very disapproving, and that's how she came out and met us, because she could not tolerate the kind of dissonance she faced in her own departments rather. As soon as the family got to know about what was happening in this front, they denounced her. They had nothing to do with her, and they stopped paying her college fee. It was fortunate that she had an older sister who by then had got married and had moved out of the family fold, who started supporting her financially, as did some of her friends and colleagues. So our work, actually, therapeutic work, included the sister, the friends, and many years later the mother, who very reluctantly and without the father's knowledge would come and participate in some of those sessions that we did with Nalini. Nalini went through hormone replacement therapy and a complete gender assignment surgery, and then eventually took up philosophy as a subject and went into spiritual studies. She's still in touch, and she writes me mails from wherever she is. And Nalini and many like her has contributed hugely in my own understanding, and it's been humbling actually to see these people go through what they have in their lives. So what it did at that time is helped us learn through these lived experiences, through the changing landscape. And from gender identity disorder, we started understanding over the next 10 years, let's say, the nuances and the differences or the overlaps between gender dysphoria, gender identity, gender expression, sexual orientation, and how that is different from gender identity and yet has a relationship with it, and what does it mean to be transgender. So these things were changing almost monthly, yearly. New concepts were coming up, new articles were being written, and most importantly, young people were bringing these to us. Young people who were going through their own journeys were actually taking us along and helping us learn in the process. So from a very biological model, we began to understand it more from the biopsychosocial understanding and approach. And of course the impact of social realities, culture, and the politics in every sphere, whether, again, like I said, in an educational institution, the way the laws were changing in the land, and the way the larger community saw this, and of course it came into the limelight particularly in 2018 when the section 377, I think it was called, was let go of. And so the dynamic nature of these influences and their interaction between each other is what we began to understand. So let's, zoom to 2018. So there was a gap now, 10 years after, let's say, I first met Nalini. I had the fortune of meeting Kuldeep, who was all of 20 when I first saw him. He was identified as a girl at birth. And I could remember very, very vividly, in great detail, the gender dysphoria since early childhood days. And of course, which increased markedly from puberty onwards. But unlike Nalini, who was gentle, quiet, and withdrawing on the face of aggression and oppression, Kuldeep was one not to be subdued in any way. So he kind of came out with what he felt, what he thought, and as a consequence that, which often happens, when young people are seen as being different in school, in other spaces where the kids are perhaps older to them, then they can be subject to bullying, to bullying and sexual abuse as well. And that's what Kuldeep went through for many years, from 8 years onwards, in school and outside school. There was of course also trouble in school because by then he was cross-dressing, making sexual advances towards girls he was getting attracted towards, and often would be asked questions like, are you a ladka or ladki? Are you a boy or a girl? Or are you a lesbian? And so on and so forth. And those are things that he would also question through those years. At 18 he discovered that he was transsexual and went out and changed, without his parents' consent or knowledge, changed his name legally to whatever it was, to Kuldeep. And of course hell broke loose in the family when they got informed about it, right? And so the extended family, after I started seeing Kuldeep alongside my colleague, who I'm sure is here somewhere, Lavina. So we both started seeing him, and I started seeing, while Lavina was seeing Kuldeep for regular sessions, I started seeing the extended family, first on their own and then with Kuldeep in the sessions. And that included parents, chacha, chachi, uncle and aunt, yeah, and they would all sit together, and in the beginning they completely denied whatever Kuldeep had shared with us. And they said that this was they had umpteen number of examples to give to say how feminine she was through her adolescent years. And all this is indeed a fiction of her imagination. So they were vehemently approached to it. And in their theory, he was getting influenced by his girlfriend, due to which not only was he wanting to change his gender, but also he had changed his name and his religion too. So there was a lot of intense angst in the family. In the midst of all this, Kuldeep slipped into depression and had to go through months of individual therapy, medication, and family therapy also continued. The family split up completely, Somewhere down the line, the parents realized their child's distress and were willing to do this journey. Although, however hard it was, they were willing to actually look into the nuances and the kind of things that Kuldeep was bringing to them. But the rest of the family, they detached themselves completely. So both dad's brothers and the family ostracized them completely. Yeah. However, Kuldeep was a person who was not going to be subdued by any of this. So he completed his undergrad from DU, and then he got his top surgery done and moved abroad for his masters with his girlfriend. In the process of management therapies, whatever you call it, we wrote to the university that he went to abroad, and also to the gender services that were there, with some good results. The last I saw him was 6 months ago. He had returned after his masters, and he told me how positive and in favor his parents are, and so was his brother, who was initially absolutely antagonistic. So there was this change that happened over many years, and we did this journey with him, and I wanted to highlight that how that changed our perspective about this whole space. While this was happening, we were also beginning to see children and adolescents, very young children, as young as 6, who were beginning to bring up gender dysphoria and how uncomfortable they were with their bodies and their roles and what they were expected to do in school or at home, as young as 6 years old. And of course, many times these were not the primary concerns in the beginning, right? It often came out later during the course of therapy, during the course of treatment. And we also found that a lot of the times the initial emotional struggle that we saw was actually a consequence of what was going on underneath. Perhaps that a young person was not aware themselves in the beginning, and then as they found this, the therapy space safe, and they started opening up more and more, that's when they, the gender dysphoria and their dissonance with it started coming out. The other thing, of course, that we encountered was this concept of gender fluidity, or the concept of being non-binary, and the choices that people have in deciding where they want to be. In a sense, combining what compels them from within, but at the same time responding to the socio-cultural milieu to be able to find their feet, to find their identity. Those were very, very strong indicators about how the practice of psychiatrists, doctors and therapists need to shift, they need to change. And over the years, I've felt that as a psychiatrist, doctor or a therapist, an understanding and sensitivity to these nuances, gender expression, preferred pronouns, and an openness to learn becomes vital. It's a dynamic process, it's a constantly changing process. So from this, we have further, I think, moved away from the medical model and the expert position where the doctor decides what needs to happen to your life. It's much more of a collaborative approach. So me moving from the single story of a transgendered person to somebody who is in that space but has many more aspects to their lives, and to be able to highlight that, to be able to look at the multiple dimensions of the person's life, family and friends, education and career, social standing and belongingness, all these things came out to us from the individuals, the families that we kept seeing over the years. The legal changes, sometimes that can be such a hassle, changing their names, their gender, while they were working. There was a policewoman who wanted to, and she started seeing us perhaps about 10 years ago, and she was already in a relationship and gave a very clear history of a gender dysphoria. We worked with her to help her change into a man, and while we were at the brink of the surgery, the police commissioner came to see us and asked us about what this all means. Which residence is this police man now would have to stay? How do we deal with it legally, and so on. So there have been these kind of interactions with the larger systems that has given us these insights. Sexuality and relationships, and indeed the identity, reclaiming a sense of self again. So the role of personal agency and choice in planning treatment again is now a lot more central in the way we work with young people with gender dysphoria and the whole range of transgendered experiences. And of course there are guidelines still, and some of the guidelines, such as the one from the American Psychological Association, they're very holistic, they're very good to read, but the guideline should remain a guideline. It cannot become a dictum, it cannot become a rigid set of rules that we can't steer from. So those are the kind of learnings that we've had, and right now we believe that we take a collaborative and respectful approach to co-create a journey at every step. So I'll stop here, and I'll invite people to comment, to share their experiences, to ask any questions.
My name is Dr. Renu Naidu. I am Assistant Professor of Sociology from Shankarrao Chavan Law College, Pune. I have recently designed one certificate course keeping in mind the holistic approach journey. The name of the certificate course is Law and Alternative Sexualities.
Sorry, could you repeat that name again of the course?
Law and Alternative Sexualities.
Yeah.
But this is not related to only law. It has a holistic approach, keeping in mind the social, psychological, mental, educational and legal perspective. So my question is, I have some psychologists, psychiatrists as well as speakers in the certificate course. As you mentioned here that the child starts expressing his or her or their gender from 5 or 6 years of age, right? Correct me if I'm wrong. What we all see in our families that there are certain gender specific roles, gender specific plays, gender specific toys. Now if a boy 6 years old feels like girl, feminine and starts playing with a doll, but our society, our atmosphere is such that we restrict, we discourage that child that no, this is not for you. Girls play only with the dolls, boys play with guns and cars like that. So somewhere do you, I want to ask that this gender specific toys, plays, does that restrict the child to express his gender or sexual orientation?
Of course, I think this goes on all the time and it happens across societies, across the world, and only a few tip of the iceberg come to spaces where they are seeking help for any of this. Most of them probably adapt to these gender stereotypes and many other stereotypes that we hold. Yeah, and there are these discourses which we have, such as, you know, when boys cry, they're asked not to cry like a girl, right? So there are these many other ways of expressing yourself that is curbed or encouraged in certain ways. Or for instance, boys are often told to, you know, behave more macho or be like a man. I mean, how can you be, you know, speak up and stuff like that because you're a man or a, you know, young man or a boy and so on, right? So those kind of things happen all the time, and I think that if we want to impact that, this space has to widen, and we have to understand that the stakeholders is everyone. It's not just a small community of people who struggle with this journey of discomfort with their own body or their gender or sexuality, but it impacts everybody. And I think that as we evolve as a society, as a community, we begin to become more inclusive and begin to look at alternatives, realizing that it makes life richer for everyone. So we are not doing it for that one child who's different, who wants to play with a doll, but it actually makes life much more exciting, because then you get many more choices of being who you want to be, isn't it? Yeah, and those are spaces that we have to nurture in various social spaces. It could be in families, in the parenting workshops that we do, it could be in schools, and the way we talk about these issues in school, and that kind of discussion, education, dialogue needs to start very early. Yeah, and that's the only way we can approach it, I think. Otherwise it happens all the time, and that, which is why there are so many people who are extremely happy and have to come to psychiatrists for treatment, because they do not get that support and that understanding, that sensitivity from the systems around. That's why they have to come to us, and that's exactly what we want to, in the long run, prevent. They should not need us anymore. You know, the community should find their own answers. Yeah. Any other comments? Yes, Kavita.
Comment, I'm using the opportunity because there are a lot of young people here, some of them are students, and I believe that this is the future. What is the one thing that you would like to say as someone who has immense experience now to the young people about what can be done to use their privilege and their position to make things better for transgender healthcare? There are many things, but I'm saying...
Okay. the one thing that comes to my mind immediately is that oftentimes when there are injustices that happen, where you can see that a person is different, and there is a lot of aggression, non-verbal, verbal, sometimes even physical, that is unleashed on people who are different, where there's a lot of othering that happens, isn't it? Yeah, and that happens in, again, educational institutions, in the playground, you know, other places that we gather as a community. And as young people, if you do feel for this, if you feel that this is important for all of us, then it's important not to be quiet during those times. Because being silent is also a kind of an aggression. You know, I mean, you join the aggressors by just being silent. Yeah, and that's why it's important to speak up, to take a stand, to highlight it in forums or places or with authorities who will listen, and not think that this is not our business. That's the first thing that you can do. Of course, if you feel even more strongly, you can, you know, there are people who have now, you know, built societies in colleges and institutions where they talk about mental health, they talk about being different, they talk about the LGBTQ community and how to include them. And there are very sensitive yet powerful voices that are coming up in these spaces. And we see that happening with a lot of happiness and excitement, actually, to see how this movement develops in all these spaces. And as a young person, you can nurture those. You can become a part of it.
Yes. So I'm Deepika. I'm from transgender community, Dr. Here. Right? Okay. So I have seen a story of Nalini and Kuldeep. Yes. But I just wanted to add one thing. आप सब यहाँ देख रहे हैं, you have seen this, that these are the childs जो कहीं ना कहीं एक अच्छे background से थे, and I am handling community at the grassroots level जहाँ पर ये सब नहीं होता है, इतने समझदार नहीं होते हैं पेरेंट्स, ये सब चीज़ें नहीं होती हैं. So from I think मीनाक्षी शायद ये सब जानती हैं, समझती हैं, तो वहाँ पे पेरेंट्स को समझाना और हैंडल करना और मैनेज करना बहुत ही डिफ़िकल्ट हो जाता है. तो यू नो आई जस्ट नीड अ हेल्प फ्रॉम यू और मैम और मीनाक्षी, कविता मैम या आप लोग बता सकते हैं कि जब हमारे पेरेंट्स हमको नहीं समझते हैं, यू नो, उस वक्त हमें क्या करना चाहिए. मतलब जब उनके पेरेंट्स नहीं समझते हैं, तब बीइंग अ लीडर हम क्या कर सकते हैं, और बीइंग अ पर्सन जो इस वक्त डिफ़िकल्टीज़ में है उसको क्या करना चाहिए. क्योंकि दिस इज़ वेरी डिफ़िकल्ट. क्योंकि आप बोलते हैं कि हम भेजते हैं आप तक काउंसलिंग के लिए, लेकिन बच्चे तो चले जाते हैं, बट उनके पेरेंट्स का क्या, यू नो, इज़ देयर एनी पॉसिबिलिटीज़ कि हम उनके पेरेंट्स की काउंसलिंग भी करा सकते हैं? क्या किस तरह से हम कनेक्ट कर सकते हैं? बिकॉज कहीं ना कहीं हमको एक डायलॉग शुरू करना पड़ेगा विद इन दी फैमिली, बीइंग अ कम्युनिटी पर्सन, कि हम एक मैसेज अपने पेरेंट्स को क्या दें कि मेरे पेरेंट्स आप तक जाएं. बिकॉज हमेशा उनको ये लगता है कि यूजुअली ना तुम पागल हो ना मैं पागल हूँ, तो क्यों जाना है मेंटल हेल्थ काउंसलिंग के लिए या साइकेट्रिस्ट के पास. बिकॉज दिस आई हैव फेस्ड, बिकॉज आई वॉज टॉकिंग टू माई फैमिली और दे हैव टेकन 2.5 years, तब जाकर दे हैव डिसाइडेड दैट यस ठीक है चलते हैं बात करते हैं.
हाँ, ये बड़ा कॉम्प्लेक्स सवाल है.
So, मुझे I can understand this is very tough.
It is a tough question, and we know that many of these things जो आपने कहा अभी, हाँ, socio-economic status, class, caste, religion, इन सब का contribution होता है in the position a family takes, है ना, जिस position में अपने आप को पाते हैं, जो intersectionality जो कहते हैं, अलग अलग चीज़ें influence करती हैं उस चीज़ को. और जहाँ पे एक फैमिली का जो, जैसे एक इंडिविजुअल का आइडेंटिटी होता है, वैसे ही फैमिली का भी आइडेंटिटी होता है ना. उनको भी एक सोसाइटी में, कम्युनिटी में जीना है, वहीं पे अपने आप को एस्टैब्लिश करना है, वहाँ रेस्पेक्ट के साथ जीना है वहाँ. और वहाँ अगर ऐसा कोई घटना हो जाता है अपने उनके बच्चे के साथ, तो वन कैन इमेजिन द काइंड ऑफ टर्मोइल दे गो थ्रू ऑल्सो. लेकिन मेरा एक्सपीरियंस में उसमें सोशियो इकोनॉमिक स्टेटस या एजुकेशन का उतना इम्पैक्ट शायद नहीं है। जैसे मैंने यहाँ पे नलिनी के बारे में कहा, शी वॉज फ्रॉम अ वेरी एफ्लुएंट, रिच, एजुकेटेड बैकग्राउंड, लेकिन उनका जो रिएक्शन था वॉज टू कंप्लीटली डिसोन हर, कि आप आइए ही मत, वापस आने की जरूरत नहीं है घर पे, ठीक है ना, क्योंकि हमें अपना जो रेस्पेक्ट है अपने सोसाइटी में उसको बरकरार रखना है। वी डोंट वांट यू हियर। ऑफ कोर्स इट बिकम्स इवन मोर डिफिकल्ट फॉर फैमिली विच कम, जिनके पास शायद जो जिंदगी की लड़ाइयां हैं हर रोज लड़नी पड़ती हैं, वो सेंटर स्टेज ले लेती हैं। आई अंडरस्टैंड दैट, बट जैसे आपने कहा आपके पेरेंट्स को भी 2.5 साल लग गया है, द थिंग टू डू इज टू स्टिक ऑन, नॉट टू गिव अप। और इन फैमिलीज में भी यही करना पड़ा हमें, ओवर मंथ्स एंड ईयर्स वी हैड टू स्टिक ऑन, और अलग अलग तरीके से हमने उनको इन्वाइट किया। बेशक ये सवाल उठता है उनके मन में कि आप पागल नहीं हैं, हम भी पागल नहीं है, क्यों जाए काउंसलर के पास। लेकिन अगर हम किसी तरीके से उनको कुछ एक दो सवाल उनके सामने रख पाए कि जिंदगी जिस तरीके से चल रही है आपकी और आपकी बच्चे की, आप शायद वैसा नहीं चाहेंगे, आपको क्या मंजूर है, व्हाट डू यू वांट ऑफ योर चाइल्ड्स लाइफ, हाउ शुड इट लुक, आपको क्या चाहिए उसमें। तो अगर उनके पर्सपेक्टिव को हम देखने लगे और सुनने लगे और समझने लगे तो फिर वो खुलने लगते हैं। ये हमारा तजुर्बा है।
मेरे आई एम टेलिंग यू व्हाट आई हैव डन, ठीक है। सो मेरे साथ जब मेरे पेरेंट्स गए थे, आई एम शेयरिंग विद इन फ्रंट ऑफ एवरीवन, उन्होंने बोला था कि मतलब उनको एक होप थी कि वहाँ जाने के बाद, काउंसलिंग के बाद, शायद हमारा जो बच्चा है, आई प्राउडली से हमारा जो बेटा है, ठीक है, ये बेटा बन जाएगा, मतलब इसकी फीलिंग्स चेंज हो जाएंगी, ये लड़कों की ज़िंदगी जीना शुरू कर देगा, मतलब उसके ट्रांजिशन की तरफ ध्यान नहीं जाएगा, वापस आ जाएगा रिवर्स। तो वो ये सोच के गए थे, और जब उन्होंने फर्स्ट इंटरेक्शन किया था डॉक्टर कविता, तो उन्होंने यही बोला था कि इसको ठीक कर दीजिए आप, हमें ऐसा चाहिए, हमें वो नहीं, मतलब उनका जो वर्ड थे, हमें ये नहीं चाहिए कि ये डोली में बैठ के जाए, हमें ये चाहिए कि ये घोड़े पे बैठ के जाए, आप कर सकते हो तो कर दीजिए। एक पर्टिकुलर एक लाइन में उन्होंने ये वर्ड बोला था, एंड इट्स वेरी, मतलब सी ये इमोशंस है मेरे और कुछ नहीं है, मैं वट एवर आई एम शेयरिंग हियर, कि ये सब डिफ़िकल्टीज़ हम फेस करते हैं, एंड मैंने जो फेस कर लिया है, आई नो कैसे मैंने हैंडल किया था, नाउ आई हैव एक्सपीरियंस। तो अब जो मेरे साथ जो बच्चे इंटरेक्ट करते हैं उनको 2 साल 2.5 साल मैं लगने नहीं देती हूँ, मैं 5, 6, 7 महीने 8 महीने में पहुँचा देती हूँ वहाँ तक। बट यू नो कि वो सबसे बड़ी बात है कि क्या ये मैसेज मुझे आप सबसे जानना है, बिकॉज यू आर एक्सपर्ट इन दिस, क्या ये मैसेज हम दे सकते हैं उनको कि चलो ठीक है, आपको यही लगता है कि हमारा बच्चा वापस पहले जैसे, मतलब जैसे आपने सोचा रहा था पैदा होने के वक्त जो सोचा था वो ज़िंदगी जीना शुरू करें, चलो इसके लिए ही चलते हैं, लेकिन क्या चलें, क्या हम ये सोच के चलें साइकेट्रिस्ट के पास कि चलो आपको जो ठीक लगता है वही करने के लिए चलते हैं, चलें तो सही, आप चलो तो सही। कैन वी डू दैट?
यस, आई थिंक दैट्स इंपॉर्टेंट टू डू। कि अगर तो देखिए कुछ और सवाल उसके बाद आते हैं कि आप उससे क्या हासिल होगा अगर आपका लड़का ही बना रहे और वो घोड़े पे जाए, शादी कर ले, तो कहेंगे कि वो नौकरी करेगा, वो सेटल होगा, खुश रहेगा जिंदगी में, और फिर वो कहीं ना कहीं जब ये रेपो बन जाएगा, है ना, एक रिश्ता बन जाएगा पेरेंट्स के साथ, तो हम ये सवाल उठा सकते हैं कि लेकिन अगर हमें दिख रहा है कि उस रास्ते से जाने पर इनको ये नाखुशी रहेंगे, इनकी जिंदगी बर्बाद हो जाएगी, तो फिर आप क्या करना चाहेंगे? हाँ, तो फिर थोड़ा टाइम लगता है वहां तक पहुंचने में।
सो जो अभी आपने शेयर किया डॉक्टर, दिस इज यू पीपल्स जॉब, मेरे को तो नहीं करना है वो, राइट?
नहीं, श्योर प्लीज।
Low socioeconomic status. So I think if you are facing difficulty to approach to the community people, the best way could be that you can approach the ASHA worker who are there in the community, because they are the one that the family accept them. So you can approach ASHA, and through ASHA you can convey, and they can help you out to get the parents for the counseling to the psychiatrist. And they are actually, Government of India has already initiated that we are checking at the community level with the assessment of CBAC form whether they are failing, and there are 2 questions about the even they have some problems, but if the family is having some certain that the child or something, they have the such problems they are having, it can be ruled out, and the family will surely accept ASHA worker. So I think that will be the best if you are thinking about community. If we have to motivate, and she will try to bring to the center as well as to the psychiatrist also. I think that would be from my side.
Thank you so much. So I think I'm going to try and summarize, and then we go on to the next talk, and we have more discussions. But I think thank you, Deepika, for sharing something so personal. I think that's how it happens. Yeah? So what you're doing and what you have managed to do is to learn from personal experience and then go out to help others to make it simpler for them. And I would say that's the way to go. You know, everything else is a strategy, a tool, and I agree completely that we have to find allies within the systems as well. And it could be an ASHA worker, it could be a Dr. Sen, it could be, you know, it could be so many people. It doesn't need to be only a professional. And one thing I'd like to offer is that we are not experts. If anything that I have learned again today from Dr. Sen is, look at the journey that he has taken us through. And to be able to share that this is where we were. We didn't know anything. And who says we know anything today? Maybe 10 years from now, this pace may change again. So I think all I want to offer is we are all in this together, and if once we are able to say, what you're doing is right. What you're doing is important. And I think we need to learn from you. And we need to learn from our personal experiences, but also the experiences of the community. And I think the leadership right now, willy-nilly, has fallen to the community. The social trend that is leading right now is not coming from the professionals. It is coming from parents. Evidence is this conference. It is coming from the community. The lead right now, the expertise right now, I believe, is coming from the people who are saying nothing about this is going to happen without us. So, offering the mantle of expertise back to you. And yes, absolutely, absolutely.
So I'll not take much time, but I'll say just one line. You are a living example of what it means to have patience as your superpower.
Yeah.
Thank you.
Thank you. I couldn't have put all this any better. This is, I think it's coming together wonderfully. ये जो Dr. Kavita कह रहे थे कि we are not the experts, you are, is it couldn't have been truer at any other time. जिस तरीके से हमने खुद महसूस किया है, and our own journey in it tells us that the only thing we know, not better, and you know it too, but the only thing we know as doctors and therapists is that रिश्ते बनाने हैं. We have to build relationships, we have to build the community. और उसको अगर हम कर पाएं सही तरीके से and make this journey, जबकि जो कि अक्सर कठिन होगा, it's not going to be easy all the time. If we are able to stick with that belief, तो फिर we will get results like we see in you. Thank you very much.
Thank you so much, Dr. Amit Sen. Sir, please stay here for a moment. And thank you all the participants for participating well. Thank you so much, Deepika, for sharing your experience. And thank you all. Now I would like to invite Professor Veena Sharma, Principal of the College of Nursing, Jamia Hamdard, to kindly present memento to our Dr. Amit Sen, who was the first speaker of today's session, as a token of love.